Pet owners get used to their pet's day-to-day habits and notice when there's a change in their behavior. Slight changes in behavior are normal, but when these changes are sustained over time, this could be a sign of a medical or psychological condition that requires veterinary action. Cats can be especially hard to read. They are masters at hiding pain and illness. This kitty's characteristic is one of their evolutionary defense mechanisms, explains Dr. Stephanie Borns-Weil, an animal behavior specialist from the Cummings School of Veterinary Medicine at Tufts University. It is only when cats are experiencing intolerable pain that they show symptoms of distress. They may become withdrawn, anxious, or display unexpectedly aggressive behavior towards their owners and other animals in the household. They may also become either extremely quiet or extremely vocal. Look for extremes. To really understand a cat's behavior, you need to watch for these changes in behavior and body, which could be signs of an illness. 1. Difficulty breathing. When diagnosing pet emergencies, breathing problems are at the top of the list. This is because breathing difficulties can be fatal for anyone, human or animal. Because of this, we put this symptom at the top of the list. Any cat, regardless of breed or age, may have breathing problems that are fatal. The respiratory system of a cat includes the nose, throat, including the pharynx and larynx, windpipe, and lungs. Breathing difficulties in cats can be caused by conditions that affect any part of this system or the brain's respiratory center. Because cats are so good at hiding disease, it may be difficult to tell if your cat has normal breathing patterns. A healthy cat will take 20 to 30 breaths per minute, and their breathing should never sound labored or strained. Normal breathing in cats should never be difficult. Some warning signs include coughing, wheezing, heaving sides, unusual respiratory noises, or the sensation of breathing weird. If you notice any of these symptoms in your cat, make an appointment with a vet right away. 2. Changes in eating habits and appetite. Anytime a cat's eating habits change, we want to know. All cats are individuals, and what's normal for one may be abnormal for another. Only you know what's normal for your cat, so only you can tell us if something changes. Cats can change their eating habits for many reasons. Stress, changes in exercise patterns, illness, metabolic disorders, and infections can change food consumption. The list of rule-outs is extremely long and may include urinary tract infections, upper respiratory diseases, valley fever, heart disease, cancer, food intolerance, gastrointestinal upset, gastrointestinal blockage, transient viral infection, ingestion of a toxic substance, mouth or throat pain, thyroid disease are all examples of dietary indiscretion. Even eating more can be a sign of illness. Some cats have a metabolic disease called hyperthyroidism that makes them eat more and lose weight. As the list shows, changing eating habits can be complex. Because of this, we want a fuller understanding of what has changed in our pet's habits. Anytime a pet stops eating, it's a medical emergency. Cats especially can die from anorexia, not eating. Kittens who stop eating should see a vet right away because they have few resources and can get into trouble quickly. 3. Drastic weight changes. A lot of people are concerned that their cats will become overweight, but unintentional weight loss may also be a significant problem. It's possible that this is a symptom of a more serious underlying health issue. You could notice that your cat has less of an appetite or none at all if it is losing weight, which is a condition known as anorexia. The cause of your cat's weight loss will determine whether or not this occurs. This is dangerous for cats because they are predisposed to a condition known as hepatic lipidosis, also known as fatty liver syndrome. This is a potentially fatal condition that can arise when the liver is forced to process large quantities of fat that has been stored in order to supply the body with energy. However, there are other medical conditions that might cause your cat to lose weight, even if they continue to consume the same quantity of food as before. If you observe that your cat is losing weight, you should make an appointment with your veterinarian right once, regardless of whether or not your cat is eating. Your veterinarian will be able to give assistance and a recommended feeding schedule to suit your cat's nutritional demands if you are unsure of what the optimal weight should be for your cat. This will allow your veterinarian to satisfy your cat's nutritional requirements. 4. Changes in litter box activities. Because cats are generally neat and have established bathroom routines, Any deviation from these characteristics should alert the owner to the possibility that the animal is in discomfort or need medical treatment. When cats all of a sudden stop defecating or urinating in their litter box, this might be a symptom that they have an infection in their urinary system, kidney stones, feline interstitial cystitis, or even a blockage. Other possible causes include, for instance, urinary blockage is a lethal ailment that occurs when cats are unable to pee. This problem affects male cats more often, because to the way their anatomy is designed, and it is more likely to occur in male cats. Cats who have this condition are in excruciating agony, and if left untreated, it may quickly lead to renal failure and even the possible rupture of the bladder. It is possible that this could induce excessive amounts of potassium in the blood, which will ultimately result in cardiac arrest. It is important to keep an eye out for diarrhea as well, since this condition may induce dehydration and inflammation in the intestines. In addition to other issues, this may be the result of poor dietary choices or the presence of intestinal parasites. If you detect a change in the manner in which a cat uses the litter box, you should see a veterinarian before thinking that the issue is purely one of behavior. This is because a change in the manner in which a cat uses the litter box may be an indication of a medical condition. 5. Changes in sleep patterns. Cats sleep a lot, so watching your slumber may not seem unusual. Watch your cat's sleep patterns closely. Changes in your cat's sleep may be the first indicator of an injury or sickness. The more you know about your cat's usual sleep, the sooner you'll notice differences. From dozing more to searching out new resting areas, your cat may be sick and need a medical visit. Even observing your cat's sick sleep postures might help you spot future tendencies. Your cat may be sick if he sleeps more than usual. A sudden increase in sleep might mean your cat is sick and resting to recover. Your cat may snooze through mealtimes and playtime. Your indoor-outdoor cat may snooze while he'd typically be outdoors exploring. Some of the signs to watch out for are: change in sleeping hours. If your cat sleeps longer or shorter than usual, they may be nursing an illness. Note that obese cats may sleep for longer periods of time due to pain or low energy levels. Changes in areas of sleep. This could be a sign of arthritis, when they can't sleep in their usual high places, or a sign of fear and avoidance. 6. Changes in grooming. Most cats are very clean, and they spend a lot of time cleaning themselves. It is possible that underlying medical conditions are the cause of any change in appearance, including bald spots, fur that is dirty or greasy, or even hair loss. In addition to the pet's outward appearance, owners should be on the lookout for changes in their pet's grooming behaviors, such as excessive grooming or a complete lack of grooming. Cats that all of a sudden start grooming themselves excessively may be suffering from allergies, dry skin, or an infestation of fleas. A cat's natural response to stress is to lick itself, which releases endorphins and calms it down, leading to excessive grooming. On the other hand, a reduction in personal hygiene could be an indication of a more serious underlying health issue. For instance, cats that are overweight may have difficulty reaching certain areas of their bodies, which can cause their coats to become matted. They also run the risk of developing problems with their salivary glands and urinary tract infections due to the fact that they have difficulty cleaning themselves. Pain in older cats' teeth or joints may also cause them to experience pain in other areas of their body, making it difficult for them to clean themselves as thoroughly as they once did. 7. Changes in social interaction. In comparison to dogs, cats can have the appearance of being pretentious and selective about the people with whom they interact. However, the vast majority of cats do enjoy interacting with their owners and other members of their family. Cat owners should be on the lookout for signs that their pets are becoming aggressive, such as when they suddenly withdraw from human contact. This behavior can be brought on by stress or anxiety, which can be brought on by changes in the household, such as the addition of a new pet or family member, a death or divorce in the family, or changes in the family's seasonal routine, schedule, or location. The natural process of aging may also bring on feelings of stress. This manifests itself in a variety of ways, such as through the act of panting, hiding, reacting when touched in an uncomfortable spot, or making noise. 8. Vocalization. Even though they can't speak, cats still have the ability to vocalize how they feel. Make a mental note of the characteristics of the sounds that they produce, such as the frequency and the volume. Alterations in vocalization could be an indicator of illness, such as asthma or an infection of the upper respiratory tract. It's possible that yowling is a sign of hearing loss, but making the same noises over and over again might be a call for assistance. On a final note, since our cats are unable to communicate with us verbally, they are unable to alert us directly when something is wrong. However, they let us know when something is wrong with them by giving us indications. As the owner of a cat, it is essential to take note of any sudden shifts in the animal's behavior, as these shifts in behavior may be indicators of underlying medical conditions. Get in touch with the specialists at veterinary if you notice that your cat is acting strangely so that they can assist you in diagnosing whether or not an urgent situation exists. Thanks for watching. If you like the information in this video, click the subscribe button to get more of it.